I would like to talk about our patient Pranav, who is 18 years old. He has been diagnosed as diabetes type 1. He has come with an complaints of taking insulin every day. That was around 32 units, and lethargy feeling, and as it is diabetic type 1, so he wanted to go to the off insulin. So he underwent a treatment of stem cells therapy, and we have acknowledged him as taking treatment of physiotherapy, yoga, boosting his BMI, and that has affected him. And on the contrary, he has come down from 32 units to 8 units, and that too not on regular basis. That is, sometimes off insulin he is, and his physical appearance has been changed, the strength has been worked on. So he has got a good review from taking treatment from stem cell therapy.
Hello. Sure. At the age of 5, I was diagnosed with type 1 diabetes. From then, I was insulin dependent until about about this year in the summer only, when my uncle referred my family to Dr. Mahajan and StemRx. They referred us to him because his aunt was going through Alzheimer's, and she was showing significant recovery. And so he said that type 1 is also treatable, so we decided to give it a shot and come to India. And then we underwent the procedure. Regenerative medicine, the only experience that I have is, of course, with StemRx. I kind of understand the basics of it, in which my immune system has to create more beta cells for it to strengthen, and through that, with the diet and exercise and the stem cell reintegration, that's how it's possible. The progress was good. Immediately after the first treatment, my readings became less and less. My blood sugar readings. I didn't have to take insulin as frequently as I did before, and my even despite the fact that I didn't have to be so dependent on insulin, I didn't have to test my blood sugar as much as before. My readings were still very consistent and very low, so that was a good sign. Dr. Mahajan was very professional in how he described the treatment. He kind of laid out the plan very. He laid out the plan very. He made it seem very easy, but there were a lot of pitfalls. But I just had to put on my big boy pants and get through the treatment, because it's for the greater good. I feel like there is hope, but they have to understand that there's gonna be a lot of sacrifices. I mean, I know for sure for me there was a lot of sacrifices, because I was a big foodie before. I used to love food a lot, and so because I've been put on this diet, I've had to restrict a lot of what I ate. But I mean, as the saying goes, no pain, no gain. So.